All right, welcome back to Sheboygan County Community Connections, our podcast. This is episode 4. We're here with Rogers Behavioral Health. You can find them at www.rogersbh.org. If you don't know or you haven't listened to the podcast, Koki and I are here to talk about resources we have in the county, mostly for people that need them or families of people that need them. In the past, we've talked to Treatment Court and Samaritan's Hand for addiction therapy needs, and now we'll talk behavioral health needs as they go together.
And I'm Koki. I'm the positivity. Well, you just call me the positivity guy. I'm with the Positivity Booth, the Positivity Recovery Foundation, and actually I collaborated with Dione before, and I'm excited to speak here. And I work in the community to bring resources like for mental health, addiction, all of the above.
All right, so have you guys introduced yourselves?
Yeah, Dione Knapp, very glad to be here today. I serve as the community relations liaison for Rogers Behavioral Health, meaning I get to help get the word out in our community about what we do and work with community events. That's how I met Koki. I've known Lieutenant Blodgett for a long time. My past career was working with crime victims through Sheboygan County, so I was there over 30 years. I worked with crime victims, helping them through the court process. I saw a lot of addiction. I saw a lot of family members that lost loved ones. So it's something very passionate and dear to my heart. I'm really glad now to be on the prevention side of things and really happy to be able to talk about the resources that we offer and some of the unique things that we have available because Rogers is in our community.
And I am Jaime Simon. I am the clinical and operational supervisor for the substance use treatment services at Rogers here in Sheboygan and Appleton and in the Madison Clinic. So I oversee kind of the day-to-day clinical needs of the patients and the staff. A little bit about me is that I worked for 8 years in Green Bay at Family Services as an outpatient therapist before coming to Rogers about 2 years ago. So I've worked with folks across the whole spectrum of substance use and mental health needs for the past, oh my Lord, probably like almost 15 years now.
Okay. So as you're listening, if you want to hop over to their website, again, that's rogersbh.org. You can find their locations, how to contact them, how to refer someone. If you don't know, they have 10 different states. They're located with 7 in Wisconsin and, of course, 1 in Sheboygan.
I can tell the story of how we came here because I think that's really important. Rogers Behavioral Health is in a lot of different areas, like we said, number of different states, but it's also not in a lot of really small communities. And Sheboygan is still the smallest geographic location that we occupy. We are found in bigger cities, some smaller in Wisconsin, of course, if we talked about Appleton, Madison, Kenosha, but across the nation, we're found in really big metropolitan areas, Nashville, Philadelphia, Seattle, Tampa, San Francisco Bay Area, Los Angeles, Atlanta, just really, really large areas. And we are really grateful that we are in our small community of Sheboygan. It's my hometown. But we're really grateful to be here, and it's because one of our community members went and used our services in another location, felt so strongly about the treatment that this person received, felt strongly about the way it was provided, that they worked with our foundation, because we are a nonprofit organization, and they worked with our foundation to bring it here. So if you haven't seen where it's built, it's just south of Aldi's on Taylor. A lot of people know where Aldi's is located. And if you stood in the Aldi's parking lot and just look to the south, you'd see the rooftops of a building. There are 2 buildings on our campus, and we'll talk about what they both do. But we are really glad to have such a state-of-the-art and just a beautiful facility here in our community. And it was because of the generosity of one person that paid it forward, one person that doesn't want any accolades for it, just wanted to help bring the service of care here.
That's awesome.
That's what it's all about, really. Once you find something that works, share it.
That's awesome.
Yeah, and I think it's safe to say that without that individual, Rogers would not be in Sheboygan.
That's awesome.
I can tell you I was working up in Green Bay when I found out that Rogers was coming to Sheboygan, and I was very excited. I didn't intend to move to come and work for Rogers, but family circumstances happen, and immediately when I knew my family was going to be relocating, I was like, I need to work there. That's the place I need to be. So I think it just speaks to the reputation that Rogers has in the mental health and addiction recovery field for excellence.
And rarely can I go somewhere to a public event, whether it's in our community or another community. Anywhere I go, people will come up and say, I had so-and-so went there, my family member, my loved one, I went there. I was just at an event last week. I was at We Heart Recovery in Oshkosh, and I had a woman who came up to our booth and just kind of approached me silently and said, I went through your Rogers program, and now I'm working in the field. She's now working in a position where she helps other people in recovery. So I just think that those kind of success stories are out there, and that's why I'm so glad you're raising awareness through your podcast, because I don't think we tell the success stories often enough. Koki does.
You just reminded me of something, and morning I'm going to cry. So somebody that was in your program, remember when I spoke there? So about a year ago, we did a fundraiser at Marco's Pizza, and a grandmother and her granddaughter came there, and they asked me to send positive vibes to their daughter because she's struggling. And I was door dashing last week, and I walked out, and the grandma and the daughter walked up to me, and she's been sober, and she said she saw me speak at Rogers. It was amazing.
You're gonna have
I've
us all
got
cry.
goosebumps.
It's awesome.
Yeah.
Like people ask me what motivates what I do, and I know I'm interviewing you all today, but I had to share that with you because
Thank you, Koki.
I mean, it's a team thing here. Like it takes, like what we're doing, bringing these resources, seeing that, and I'm able to tell that story right here too. So like, it's just amazing.
That's awesome. And we'll get to that and why it's so important that we lift up all different paths, because there's not one way for everybody. You know, that's another reason why it's so good that our community, it's not, one's better or different. It's just different. You know, we are different than some of the other providers. But I think that everybody needs all the resources on the table so they can find what works best for them. But that is so awesome to hear that. That's so
no matter
awesome.
what avenue it is, the goal's the same.
Yeah. We just want people to live a better life.
Yeah, it's hard when you go to a call and, the mom or grandma in most cases is so upset because they don't know what resources they have for their children. They're now taking care of their grandchild while their child is struggling to find a resource or continue using the resource, because that's a struggle as well. And when we don't know the resource to be able to say, hey, go talk to these people. I had one in the lobby the other night that we were talking for quite a while, and I'm definitely there as long as I'm able to have that conversation. But it was one of those things where I'm like, oh, because of this, now I know what resources I can push you to or guide you towards. I can't force you to take those resources. But if you're aware of them, you're more likely to be able to use them and be willing to use them.
I agree. It's also an open door where we've had people come through our doors and maybe the first time they weren't successful, or maybe they did gain some tools, but they needed additional tools, or they came back a second time. That's not a failure. That's a success. That's how we feel. We have a great resource for children that we'll talk about today too. Definitely something that when you mentioned grandparents, we have something that's awesome that we want to talk about, where we're doing something for kids that have been exposed to substance use disorder, a workshop that's free to them. Cool. So we'll talk about that today too.
Awesome. So what kind of resources or services do you have at Rogers?
So at our Sheboygan location, we offer partial hospitalization treatment, and that program is 6.5 hours a day, and we offer it for a variety of different diagnoses. So we have our substance use service line, which is geared for dual diagnosis. So we are going to treat mental health and addiction at the same time. Evidence-based practice tells us that if we try to prioritize one over the other, it's not going to be successful. So we do it together at the same time. But we also have service lines in depression recovery, OCD and anxiety, trauma. We have programming for children, child and adolescents. And then we have our intensive outpatient service line, and that's going to be 3 hours a day. We really encourage stepping down in terms of what we call our pathway of care in terms of intensity. So we might start someone with a partial hospitalization level of care. As they go through treatment and are getting better, we step them down to intensive outpatient, and then we move them to an outpatient level of care. Because again, the research tells us if we step folks down systematically, they're more likely to have more success long term versus if they just do a few weeks in our partial hospitalization program and then we send them on their way, they're not as likely to maintain that progress that they made in treatment.
We use a lot of big words in the medical field. So when people that I work with or families hear the word hospitalization, they actually think, going into a hospital and being locked in and things like that. Just to make it really clear, when Jamie's talking about our services, people come to us during the day and they go home and they sleep in their own beds at night. We use the term hospitalization just to refer to the level of care, but it's not a stay locked in for overnight facility, not in Sheboygan.
And I would add that within the Rogers system, we do have residential level of care, and we have inpatient hospitals. Those are going to be in West Dallas, Oconomowoc, and our Brown Deer locations. And if we have somebody coming in, let's say they've relapsed on a substance and they're medically not stable, we can work within our system to get them to an inpatient hospital, get them to the level of care that they need, and then work with them to get them back where they need to be once that detox has happened. I really like that we have that fluidity and flexibility to get people where they need to be at any given point in time.
Yeah, it's interesting. A lot of times, throughout my career, you talk to someone who went to jail and don't have access to, what they're trying to use or what they're caught on this week, and they get out and you talk to them, or even in the middle of a transport, you have that conversation of what's your plan when you get out. I'll go hang out with my friends and go hang out. And it's kind of is that how you got to this point? Where if you start to wean things off, to me, I simplify it to cigarettes. You're not just going to quit cold turkey because it's going to sit there. And say you've been off of them for 2 months. That's a single smell of you're right back there. But if you start to slowly take it away, you're a 2-pack a day, now you've gone down to 1.5 and slowly take it down, then you're building that idea in your own head, and that, I guess, way you're doing it to really keep it in that same momentum of, okay, I've weaned myself off this, I really don't need it. And at the end, as you continue, you're always going to have maybe a little something there, but it's way easier to keep it off the table.
Yeah, we certainly want to encourage philosophies of harm reduction. So if a person is coming in and they're struggling with wanting to be ready to stop one substance, but they're ready to stop another one, we're going to meet them where they're at with the goal eventually of tackling whatever substances they have that would be of a concern. But we certainly meet folks where they're at, and we try not to force them to make a change that they're not ready to make, which can cause some challenges sometimes. But we really find that it's a philosophy of, we work with you, we don't tell you what you have to do.
It's just like medication-assisted treatment. Some people are very successful with medication-assisted treatment. I think that, even as a field, some substance use providers will say, well, that's not acceptable, or, it's just some people don't feel that that's a tool. I've seen a lot of different stories and a lot of different people that know that it's just one tool. It doesn't mean it's the right tool for everybody, but it is a tool. And I've had people say that they would not have been successful without it. And I think sometimes we have to give people all the supports they need just to help them clear their heads, to be able to accept the new information coming in and replace the thinking, give them new coping skills, give them new ways of viewing things. So we work with medication-assisted treatment. It's not required in any way, but we will respect and work with programs. Whether we prescribe it or they're working with another provider, we partner with Clean Slate, we partner with Sheboygan Comprehensive Treatment Center. We're open-minded on that. We want people to be successful.
Mm-hmm. And I would just add to clarify that when you're in our programs, you're going to meet with somebody who can prescribe that medication on site. So it's either a psychiatrist or a nurse practitioner. And we can work to establish care. We can maintain care you've already had. We just want to make sure people get what they need. And as a part of our discharge process, we're going to make sure you have some kind of medication plan moving forward. So whether that's with one of our psychiatrists, we have now outpatient psychiatry services in the state of Wisconsin, or if you want to use your primary care doctor or a psychiatrist you've used before, we're going to try to do our best to make sure that you're set up, that when you walk out the door, you have the support you need to be successful.
Now, do you work with adolescents?
At this time, we work with adolescents in providing mental health recovery, but we do not work specifically with substance use disorder and addiction. So we definitely see adolescents that have it as a secondary issue, and we'll work with that. But it depends on how high the use is and the acuity. If the acuity is too high, our Sheboygan clinic is we're stretched at at the seams right now for programming. We serve a lot of people. If the adolescent had a really acute addiction, we would send them to our services in West Dallas. They would probably
and I would add that we can collaborate across teams. So I mentioned we have our different diagnoses tracks that we have. I am more than willing to help our child adolescent programs if they have somebody coming in with, that might be an adolescent smoking marijuana, and offering to support that to address that part of that individual's treatment.
So now is that if they need does it need to be an addiction issue, or can it be mental health?
We have a program specifically for mental health only. It's more the addiction that we struggle with, and it's the primary.
Because I run into a lot of younger adult or teens in the community that are struggling, or their parents actually, that ask, "Hey, do you know any resources? I could take my kid because they're having trouble getting in line or getting in to see somebody for months."
Yeah, we do. We have the same level of care, Koki, where people come to us 6 hours a day, and then they step down to 3 hours a day, and we even help them assimilate back into school. They work on schoolwork when they're in our program. They're taught a lot of coping skills. It's kind of similar to what we do on the adult side. We're just trying to help give them some tools and some resiliency so they can go back to whatever level of wherever they were before. But that's ages 13 to 18. We take some 12-year-olds, depending on how mature and verbal they are, but usually it's ages 13 to 18. If they're still in high school, they can stay in our program on the adolescent side. Once they turn 18 and they're out of high school, then they're on the adult side.
I think a lot of the parents were middle school kids. They had middle school kids that were they're on waiting lists to see somebody. So I was curious.
An interesting time in a kid's life for sure.
Yes, there's a lot going on. It's changed a little bit since we were all there.
Oh wow! Yes, I could imagine.
Yeah.
I could go online, right, with whoever I wanted to talk to when I was in school. You didn't
And
have to call and ask to speak to my friend.
And everything you did was recorded.
Yes, literally.
Yeah, back when it was music, song of the day on MySpace, or change your ringtone to the song of the day.
Now there was videos on MTV.
Now it's my phone's on silent.
Let's not date ourselves, everybody. Our listeners have no idea. We're all in our 20s.
Yeah, he took my picture before. They know I'm not in my 20s. So what are some of the other benefits of your program that we haven't touched on?
Well, I think we really just want to help people be their best and healthiest selves. And we are really working to expand that impact outside of our clinic and really make it a community effort. We have a lot of community partnerships, but that success story that you shared, I appreciate hearing that, because we hear those snippets every once in a while, and as somebody on the treatment side, we don't get to hear those stories that often, so I appreciate that. But really it's just about lifting up the community, making the community healthier, providing a resource that this community has not had. It's been a gap in the services in this community, and just really wanting to be healthy and well.
So I want to talk a little bit about how all of our programs are voluntary. And I think that's an important thing when we talk about recovery, where people have to want to come for help. We work closely with all of our partners, like Jamie said. We work with probation and parole. We work with the courts. We work with individuals that just come to us on their own. You can self-refer. You can call and get a screening without any other professional saying you need to do it. But people still have to come in on a voluntary level. Some are more voluntary than others. Some are more warm to the concept. But I think, just knowing that everybody's coming to us on that equal footing with no judgment, and just wanting to live a better life, that's kind of where we would approach things. And then we look at barriers. Is there a reason why someone can't get to treatment? Or maybe why they haven't been successful in the past. The reason I bring that up is because we also believe in offering all options. We want people to get involved in the recovery community before they leave our program. What Koki referenced is that he has come to our program to talk as a part of our community partnership with Lighthouse Recovery. Lighthouse Recovery comes every 3 weeks to our program. They've done so for almost over a year, and they bring up all the resources. So we don't just talk about one service, we talk about the whole gamut in our community. We talk about Right Way, 1907 Club, Samaritan's Hand. We talk about Lighthouse. We talk about even things like the community cafe. If a person needs resources, we want them to know where they are before they leave our door, and we want them to connect to even a recovery coach or a sponsor, whatever that would be for a person. We want them to get involved before they leave, because we know their chances of success are greater. Just like Jamie's talked about, we're on that continuum of care. If you go through the programming and you've done each successful part, you're going to have a better outcome. We know that if you get connected to the recovery community, you're also going to be better successful.
That was my missing piece every time I got sober, was the community interaction part. I even after prison, I didn't do it. I'd be clean for 6 months, but I still isolated back to the same people that I was hanging out with and didn't interact. But now, interacting with the community is like a huge part of my recovery.
That's awesome.
It's all about the environment and the supports. We think about, I'm going to use a term from Psychology 101, Maslow's hierarchy of needs, right? We need to have an environment that's going to set somebody up to succeed. And really, we want to cultivate that within the larger community and then for each individual. Because if I can talk to somebody who's in treatment and say, hey, let's get you connected to Lighthouse or whatever, the 1907 Club, like, you're going to have that support. And that is one of the biggest challenges of recovery. If you don't have somebody, it's really tough to maintain that sobriety long term.
Being connected helps keep you accountable. It gives you strength, and it gives you the hope that you're going to make
That's
it.
why I put myself so far out there on everything. You know how many people would call me if I started slipping, if I did something out of the ordinary?
Yeah, you're kind of a living role model of accountability.
Yeah. So what does a typical day of programming look like?
So our programs, like I mentioned, are partial hospitalization, run 6.5 hours. In Sheboygan, our programming hours, it depends on the service line that you're receiving, but they're generally from about 8:30 in the morning till 2:30 or 3, depending on which program you're in. And it's a little hard to describe that or answer that question because our treatment varies by what your diagnosis is. So I can say that our substance use service line is mostly group-based. The reason is that research tells us that you're going to be more successful if you're in a group setting for substance use. Now, our OCD and trauma programs are much more individualized. I think they have maybe 1 or 2 groups a day, and then they're doing individual assignments. So you're either in group or you're working on individualized assignments. We do offer, for most of our service lines, an hour of individual therapy a week, so you are going to get that one-on-one contact with a therapist. You're going to be meeting with a medication provider, prescriber, once or twice a week, depending on your level of care, and we have a nursing team on site. So all of our treatment programs have standardized manuals that we use, and you come in and we give you a workbook, and that's what we base our treatment on for the different programs that we have. I want to say our mental health and addiction recovery workbook is like 300 or 400 pages. It's a little intimidating, but we go through that workbook on a 3-week rotation, and it's repetition. So our standard level of stay is, I think, about 6 weeks. We're going to try to get you through that workbook twice in the time you're there, because we know the first week you're coming in, you might not absorb a whole lot if you're not feeling well because you're in withdrawal or things like that. So we want to try to get that material to you twice so that you can learn and integrate it differently the second time around versus the first time. We have lunch breaks. We have one of the things that I think is very popular is our Keurig machines. We do have those on site, and Holly, our clinic assistant, stacks them very well. A lot of great varieties and flavors. I think toasted graham is the favorite.
I've heard that.
But you get to take a lunch break during the day, so you have a half an hour of time to kind of go off campus and grab some lunch. If you want to go to Panera or Quick Trip or whatever. But really, I think that's about a day. The PH or the IOP programs are shorter. They're going to be 3 hours, and most of that is going to be group based for the substance use line of treatment.
So when you have those 2 different programs running, do people intermingle?
That's a great question.
The groups, do they get together?
They do. Well, let me say this, it depends. In our substance use service line, we have the groups are intermixed. So our PHP, our partial hospitalization, and our IOP patients are mixed together. We actually have 2 different time frames for our IOP program. I believe one of them is from 8:30 to 11:30 and then noon to 3. and they're in groups with the PHP folks. And again, the reason for that is we know when they're together, we can learn from each other. So our folks who are a little farther along, the IOP folks can kind of be mentors and support folks who are just coming into the program. So that's been a change within the last couple of months that we've been navigating. We're still working out some of the kinks. I think in some of our other programs, they are a little bit more separated, the PHP and the IOP. I'm less able to speak to those because I'm just not as involved in the side.
I don't have a lot of patient contact just because my role is in the community. But just a couple weeks ago, I had someone that I was just kind of coming into the hallway with, and he was just so excited to announce that he was stepping down from the higher level of care to the lower level of care, because it is kind of a graduation. It means that you were doing well enough that your treatment team, as a team, agreed you can start coming for lesser hours a day. And you got to see how that kind of motivates the other people in the group, because they see that, this is a person who's almost there, they've made it halfway. Yeah, you can do it too. So I've seen that firsthand. It was pretty powerful that this person was so excited about being gradually stepped down.
Yeah, and I want to speak to, how do we make that decision to move a person from one level of care to another? We use something called the ASAM tool, the American Addiction Society of Medicine, something like that. Anyway, it's a screening tool that we evaluate 6 different domains of where an individual is at. So we look at what's their risk for withdrawal, what kind of medical conditions do they have, what's their mental health needs, what's their readiness to make the change, what's their relapse risk, and what's their housing environment look like. That's the tool that we use to guide what level of care is appropriate for an individual. So we're not necessarily making that move until those guidelines tell us that person is ready. And there's some clinical judgment and motivation from an individual that we take into account. But I just want to make it clear that we're not just arbitrarily deciding when a person is ready to move on to the next step of treatment.
That's not just their choice.
Their voice has a say in that, for sure. We balance all those things, but if we are making a recommendation, we're going to be very clear, this is what we think you need right now to be successful.
So one thing I want to bring up before we get too far into everything is we have this wonderful program also on our campus that's called supportive living. And we have not talked about it yet. It's a one of a kind. There are no other supportive living buildings in the United States. It was built through the generosity of our donor, and it is a safe place for people to stay while they're in treatment. So I think that's why people sometimes get confused and think that we have like inpatient level of care, but it's actually just a safe place for someone to live if their home environment's not safe or it's not conducive to treatment, or a number of different reasons. People can pay a straight fee to stay there, or they can apply for assistance through a patient care grant to stay there. And people are there for lots of different reasons. But it's also another support for if your home environment is not supportive, not conducive to recovery. It's just another option.
Mm-hmm. And it's beautiful. It is nicer than several hotels I have ever stayed in. I don't know if you guys have seen it yet, but it is beautiful. Pretty nice.
Well, we get a tour today.
Yeah.
Haven't been in. I've certainly gone past as we go to Blue Line. And
Exactly. We're on the road to Blue Line.
Yeah, we certainly see it. So how would you measure success in the program?
Well, I think I already kind of spoke with that with the tools that we use to help make those decisions. We also use different mental health and addiction outcome tools to help us determine when folks are ready for treatment. So things that measure depression rates, anxiety rates, cravings, relapse risk, urges to use those kinds of things. So those are the standards clinically that we use to determine success. But I really tie it back to the stories of the community that we hear. Your story, I know you've talked about somebody that you encountered out in the community after they received services and I think said something to the effect of, we saved their life. Yeah. That to me is how I feel like we really measure our impact.
I agree. It's not always in the numbers, it's the stories that you get to tell.
Yeah.
Yeah, it's hard. One of those things that you're never truly done recovering.
Oh, no.
So it's hard to say, yep, rubber stamp, done. Just because they walk out the door doesn't mean they won't be back. And it could be for good. It could be maybe a relapse, or it could just be a, hey, this is how I'm doing. I wanted to come say hi.
Yeah, and we get that all the time. And, one of the things we emphasize if a person, if they're discharging, maybe not in the position we love to see them in, we're telling them, hey, can you come back? I can think of a recent incident in one of our other clinics where we had somebody that unfortunately we had to discharge under not the best of circumstances, and I told the therapist, hey, call them, send them an email, tell them they can come back whenever they want to. And, it happened on a Friday. By Monday, the person had called back and was like, I'm ready to rescreen and give it another go. We always want to have that door open. I think one of the, we talk about the concept of stigma. That's a whole other can of worms that we might not be able to get into today, but you hear so much in the mental health world of the revolving door, kind of that's seen as kind of a negative connotation. And I don't think of it like that. I think of it like, I want to create a place where folks can come back to and where they feel supported and safe, that if they are struggling, they know they can come to us and we're going to try to get them further along their recovery journey, whatever that looks like. I don't see it as a problem. Yeah.
With no judgment.
Mm-hmm. And that's a big one in the community. And I work on it daily too. But that's a huge, the stigma with everything. And it's amazing what y'all are doing. We need it.
So tell us about your workshop for children.
I'd be glad to. So we had a generous donor from our community that wanted to do something for children who have been affected by addiction. And our medical director, Bob Jaime, a medical director out of Florida, wrote a coloring and activity book with the assistance of 2 other inpatient counselors. So all Rogers employees, 3 different people, got together and created an activity book called Gilly Learns He's Not Alone. And Gilly Learns He's Not Alone is helping children understand addiction from an age-appropriate level. So the purpose of the activity book is just to help kids understand what it looks like. It's not their fault. It's not about whether or not they clean their room or do a better job or whatever else. So it kind of gets at some of the stigma and just helps kids understand and build resiliency. So the workbook was created, and then a workshop was built around the workbook. So we've done 2 of them already on Saturdays. The next one will be May 11th. So May 11th, 2024. We're taking applications for it. The workshop is free. I'm going to leave some of the flyers here at the Sheriff's Department so that they have them. I've been trying to blanket this information in our community. But what happens is the kids and the parents show up that day, and the kids engage in a ton of activities. They do things like make jewelry. They work with beads. They do some crafting. They do some self-care kits.
Yeah, and really the whole activity for the kids is to have fun. A lot of times life for these kids is very stressful if, the home environment isn't super stable, and it's kind of geared to create some normalization around the challenges these kids face, create some connections with other kids who might be going through something similar, because a lot of times this isn't something kids feel like they can talk about freely. So it's really about normalization and recognizing and trying to take pressure off of the kids to try to fix the problem, because a lot of times that's something they will do. It is not therapy for the kids. I want to make that very clear. And we may make a recommendation for some treatment or for some therapy if we feel like that's appropriate for the kiddos. And concurrently to the kids events, we've also been providing some education and support for the caregivers. So when kids come in, we do have a adult caregiver that we want to have on site with them for the duration of the program. And we use some of our programming from our family support programs that we have for all of the Rogers clinics. Have a family and friends program where you're in treatment, you can come in and just learn about what we do and how to support your loved one. We pulled some of that material to use in our SOAR program, the children's programming, just to provide that education and support. We do a combined meal with everybody, and then we have a closing activity. We plant flowers, which speaks to my gardening passion, and with the hope of kind of growing and moving forward in a positive direction.
So we've had 2 small groups go through before, but the kids have a great time. They go home smiling. The adults have been with all different backgrounds. Sometimes the adults in the group are the ones that are in recovery themselves. Sometimes they're the grandparents raising the grandchildren. Sometimes they're caregivers, and sometimes they're loved ones. But we've been able to blend this group of adults while the kids are doing the activities, and we've had 2 amazing days where it's just been very healing for everybody. So this is something that's unique to Sheboygan. It's called Strength Over Addiction Recovery, or SOAR. there's a lot of other acronyms for that, or it's used for a lot of different things. But it's free, and the Gilly Learns He's Not Alone was the underpinning, of the workshop. But we've been very delighted to offer this in our community, and it's pretty cutting edge kind of stuff. They might transfer and hopefully provide it at some of the other Rogers locations in the future. But right now, the grant that we have was specifically for our community, so we're offering it free to families here in Sheboygan.
Very cool. So if somebody wants to come, do they get told to go talk to you guys? How do you bring people in?
Yeah, I will communicate with them almost like a concierge. I'll take their information, send them the release forms. If they can't do it by email, I'll send them physical copies. But I'll work with them and coordinate with them. There's only one registration form and one liability waiver form. So I will work directly with them, and they can make a reservation for that day. Okay. And we're open to families attending. So we're glad to have people join us. The kids, like I said, have gone home smiling, and the parents have felt like a weight lifted off their shoulders. Maybe just learning a little more about how to support their children in this setting.
And seeing the kids smile alone, sometimes that's, in those circumstances, you don't always get to see the children smile. Okay. Is there anything else about Rogers we should know?
I think, one of the driving forces within Rogers is excellence. We want to provide a high level of evidence-based care. We are always evolving our process to match what research is telling us is going to be the most effective care. And that's one of the things that attracted me to the company when I originally started with them. And I've seen it happen, and we're always trying to take care of the patients and our staff to make sure that they are fully able to be available for the folks that we serve.
I think many years ago, our social media line, which probably way before social media even was, if you don't get help with us, get help somewhere. And I think I just want to reiterate that we may be the right journey, maybe we're not, but there are resources. So for family members or for people who are on their own recovery journey, there's hope, there's resources, there's always opportunity for change.
Excellent. Yeah, some of the resources we've talked about so far are obviously Rogers Today, Health and Human Services, a good spot to go. Just hang out in the lobby and ask for a resource for what you need. Samaritan's Hand is another one. Again, they're open to having your group sessions and just having to sit down and be able to talk with other people going through the same things, religious or not. They'll welcome anybody. And I don't know of any resources in the area that are going to turn you away based on whatever. They want you to get the help, just as we do here.
The goal is the same.
Yeah.
So thanks for raising the awareness that you're doing.
We're trying. So, all right. Well, thank you both for coming. Today we had Dione and Jaime from Rogers Behavioral Health. And, of course, there's Koki, and I'm Tony.
Positive vibes.
All right. Thank you.
Have a good day, y'all.